Hi everyone, I'm Naman Arora, a second year MBBS student at Manipal Tata Medical College, Jamshedpur. Today we'll be studying about penicillins. So now we'll be seeing at the mechanism of action of penicillin. As we all know that penicillins are as we all know that penicillins are cell wall synthesis inhibitor. Uh, how do penicillin work is that there are bacterial cell wall is composed of peptidoglycans. Peptidoglycans are NAG and NAM, and they NAG and NAM are connected to each other. At the end of NAG and NAM are D-alanine. What does the enzyme transpeptidase do? Is that they remove the D-alanine. The enzyme transpeptidase remove D-alanine and help in formation of connection between NAG and NAM units. So what do penicillin do is that they are the structural analog of D-alanine. They inhibit transpeptidase. By inhibiting the enzyme transpeptidase, they inhibit cross-linking of peptidoglycan, and cell wall is not synthesized. When cell wall is not synthesized around an organism, uh, water enters and there is osmotic imbalance, and it leads to cell lysis. Now we'll see the penicillin classification. Penicillin are classified into first two groups: natural penicillin and semi-synthetic. Natural penicillin में आता है penicillin G, and in semi-synthetic penicillin we have acid-resistant penicillin. Acid-resistant penicillin is penicillin V, then penicillinase resistant, methicillin, cloxacillin, and dicloxacillin. Then we have extended spectrum penicillin. Expanded spectrum penicillin में हमारे पास तीन ग्रुप्स हैं. अमाइनो पेनिसिलिन, इसके अंदर आता है एम्पेसिलिन और अमोक्सिसिलिन. फिर कार्बोक्सी पेनिसिलिन. कार्बोक्सी पेनिसिलिन के अंदर हमारे पास आता है कार्बेनासिलिन. और यूराइडो पेनिसिलिन के अंदर आता है हमारे पास पिपरासिलिन. तो सबसे पहले हम देखते हैं पेनिसिलिन जी को. पेनिसिलिन जी पेनिसिलिन जी वाज द फर्स्ट पेनिसिलिन दैट वाज एवर सिंथेसाइज्ड. पेनिसिलिन जी है बेंजाइल पेनिसिलिन. ये ओरली इफेक्टिव नहीं होती. इसको हम या तो आईवी देते हैं, आईएम देते हैं. ये एसिड लेबाइल होती है, यानी कि स्टमक के एसिड इसको ब्रेक डाउन कर देते हैं. ये ऑर्गेनिजम्स ग्राम पॉजिटिव ऑर्गेनिजम्स स्ट्रेप्टोकोकस निमोनिया, स्ट्रेप्टोकोकस पायोजीन्स के अगेंस्ट इफेक्टिव होती है. ग्राम नेगेटिव कॉकाई मेनली निसेरिया मेनिंजाइटिस के अगेंस्ट. और स्पायरोशीट्स ट्रेपोनीमा पैलेटम, ये सिफिलिस के अंदर ड्रग ऑफ चॉइस होती है. इसका एडवर्स इफेक्ट होता है हाइपर सेंसिटिविटी रिएक्शन. सारे ऑलमोस्ट पेनिसिलिन का एडवर्स इफेक्ट है हाइपर सेंसिटिविटी रिएक्शन. There are some negative points of penicillin G which makes it less suitable for use. For example, it is not orally effective. It has to be given either IV or IM, uh, which which the patient cannot self-administer. Then it is susceptible to enzyme penicillinase. It is narrow spectrum, and it causes hypersensitivity reaction. So therefore, we have developed some new penicillin, semi-synthetic penicillin, which overcome some of these issues. First in the group is acid-resistant penicillin. Acid-resistant penicillin is penicillin V or phenoxymethyl penicillin. It is given oral, so it is not acid labile. Patient can self-administer it. So now we have penicillinase resistant penicillin. Penicillinase is an enzyme that breaks down beta lactam ring. As we all know that penicillin are beta lactams. That is the beta lactam ring in their structure. So what does penicillinase enzyme do is that they break down beta lactam ring. Uh, what organism? Not all organism can produce penicillin and penicillinase enzyme. Only few organism, for example, Staph aureus, can produce this enzyme. So drugs in this group are methicillin, cloxacillin, and dicloxacillin. Methicillin is a acid labile drug, whereas cloxacillin and dicloxacillin are both acid resistant. We use these in case of Staph aureus organism. Now we have extended spectrum penicillin. First in this group is aminopenicillin. Aminopenicillin, there are two drugs, ampicillin and amoxicillin. In what organisms do we give these drugs? We can remember it by the mnemonic HELPS, double H, double E, L, HPSS. First is Haemophilus influenzae, second is H. pylori, E. coli, Enterococci, Listeria monocytogenes, Proteus mirabilis, Salmonella, and Shigella. How is amoxicillin different from ampicillin? Uh, Amoxicillin is a little better than ampicillin because first its oral absorption is better than ampicillin. Second, it is given less times a day. For example, amoxicillin is given 3 times a day, whereas ampicillin is given 4 times a day. This improves patient compliance. Third is the decreased incidence of diarrhea. In ampicillin, there is increased incidence of diarrhea, whereas amoxicillin is better in this respect. But ampicillin has one better point that it is more active against Shigella and influenza, Haemophilus influenza. Whereas amoxicillin is more active against Streptococcus pneumoniae, whereas like it is better than penicillin in this comparison against Streptococcus pneumoniae. Third category is carboxypenicillin. Carboxypenicillin has carbanicillin, the only drug. It is inactive orally. It is used against organisms Pseudomonas aeruginosa. Another category is uridopenicillin. In this category, we have drug piperacillin. Piperacillin is used against Pseudomonas and gram-negative bacilli and anaerobes. Now, what are beta-lactamase inhibitor? As we all know, beta-lactamase is the enzyme that breaks down beta-lactam ring. So we have a few inhibitors. These inhibitors, when given with the drug, can increase the antibiotic spectrum of the drug. For example, there are three beta-lactamase inhibitors. First is clavulanic acid, second is salbactam, and third is tazobactam. Clavulanic acid is given with amoxicillin as amoxiclav. Salbactam is given with ampicillin and tazobactam is given with piperacillin. Hope you liked the video. Thank you so much.